Hello, everyone. Good evening. Welcome to Power Hour. My name is Monika and joining me today with great privilege is our fantastic Olga. Olga, thank you very much for joining me today.
Thank you for having me.
I'm going to tell you straight away, I have a million questions for you, so you better get prepared. So please, Olga, tell us, who are you and what do you do for perfect balance?
So I am a sports rehab therapist, and I do well-being part of the perfect balance, exercising with the people, helping them to get better through regular exercises.
Amazing. So, first question that I have is, you said you're a sports therapist, which obviously I imagine must be quite useful in Pilates. But am I wrong? Does sports therapy help you with Pilates training? How do they work together?
Well, yes, being sport rehab therapist, I found often after injuries, we have to go back to basic exercises. Lots of core strengthening, lots of balance work. And Pilates is one of the best things to do to get started with someone, to feel better or get stronger, get back to favorite sports they do. It's always going back to Pilates.
That's very true, actually. So I think a little birdie tells me that some of the classes that you teach are really specialist. So you teach prenatal, you teach postnatal, you teach healthy hips, and you also teach an advanced form of Pilates, which is the Pilates for runners. So if let's start with mums to be and new mums. What are the main differences between the two? What are the main objectives for each group? So mums to be versus new mums, how do they differ?
So pregnancy Pilates, we aiming to keep our body cardio fitness during the pregnancies, maintaining healthy weight, improving that your core muscles, your rectus diseases and pelvic floor are being healthy through the pregnancy. And the postnatal is more like strengthening and toning and feeling better, much better about yourself and body to get you back onto the normality which you used to have it before having a child, or children. It's very one of them. One is more into focusing on good cardio and heart rate and fitness. The other one is to make sure you get back to yourself after pregnancy.
And is it true that it's worth doing both? So doing the prenatal helps postnatal, if that makes sense. So being active and exercising in pregnancy helps you recover quicker after.
Exactly. Once you know the Pilates and once you know the movements during the pregnancy, it's much easier and quicker to come back to where you've been before, as you're in a kind of routine. It only takes 6 weeks after pregnancy when you can start Pilates, so it's very quickly time going. So you have only 6 weeks of gap between one and the other. So definitely beneficial, and you keep going with your exercises, and you know the teachers, and you know the other people you might meet lots of other mom to be, which they might becoming your friends as well over this very important time.
Creating a little mommy's club.
Yeah, it's a coffee morning.
Yeah. That's brilliant. And are there any restrictions for the prenatal, so mums to be? Are there any parts of the pregnancy that is not suitable or not advisable to work out during?
Yeah, first of all, you should have agreed with your doctor that everything is fine to go and to do exercises. With the severe things like significant heart and lungs problems, like a severe anemia, people who have bleedings during the pregnancy, they should be very careful. There might be contraindication with that, but you always check with your doctors, and if we take individual person, and we assess everyone before starting the class. So we have an assessment and lots of questions as well to make sure that we have a green light to go ahead.
And that's how I imagine your sports therapy comes in handy to be able to do that. So that sounds really interesting. A little bit of a different subject, Pilates for runners.
Yes.
So I don't know if necessarily a lot of runners that we see connect the fact that there is a Pilates form for them. So what is the objectives of Pilates specifically for runners? What is it aiming to do? How do you tailor those classes for those people?
So as the running is endurance exercise, Pilates for runners, advanced level, endurance level, we do exercising for at least 1 minute each of the exercise. We do it in a very high level, the highest exercises we can go with Pilates. And as well, it's good to keep your core strong, as you can see all the lovely athletes when you look at them core. It's amazing, like a steel. So there you can see the top level athletes, they have a wonderful, and they do Pilates daily. And as well with the runners, we tend to use the same muscles when you run. With the Pilates, we do body weight sort of exercises, we do arms, we do balance, which all comes together to be better runner.
And that's, I think it's really, really important to know, because we see so many runners that, and it's, I think you can probably join me in thinking the same thing. It's very often that you see the runners that are only focusing on running and increasing the volume of running, and they may occasionally include some stretching, but there's a little bit of that misconception as to what strength work can do to improve your running. So the objective is still to be better at whether to have a better time at running or to run for longer distances. But it's quite surprising to see how many people just focus on increasing the volume of running and not really supporting it with a proper strength work. So
yeah.
do you? So we have balance for them, which also is such an incredibly important part for the runners. We have core strength, which can improve their times and the overall stamina during the running. What about for people that run into quite reoccurring injuries? Would you say that would help them prevent those occurrences?
Yes, research shows that yes, it's improving and it's preventing from any sort of problems could be knee, could be your ankle, which you can easily be done when your body is not strong enough to cope with the running or longer distance running, or once you're putting more pressure on your body during the increasing the timing. So definitely it's one of the preventions.
What about the intensity, Olga? Because there's a lot of times we're getting asked, so how many times on top of my running should I be doing, say, Pilates for runners? How often would you advise people to do that? Is it once a week, twice a week, every day? How do we plan it?
I can do every day if you like. Yes, definitely. Research paper shows that doing twice a week Pilates for 6 weeks, you're going to see improvement and you're going to see the benefit. So I will say try twice a week.
Mm-hmm. Okay. You heard it, guys. Twice a week on top of your running. So another type of classes, which are a little bit more rehab specific that you run, is the healthy hips and the upper body classes. So tell us, how do they sit in the rehab? Who are they suitable for? And what type of benefits can people expect from those classes?
With a healthy hip, the population I see, often they had some sort of problem, maybe had a hip replacement, hip surgery, or broken hip bone. Pilates is very good way to start strengthening that buttocks muscles, reteaching that lower body to work together again and get connected, and get the strength from your front of your body to walk better, because that's the main problem, is even sometimes walking is a painful. So improving with that one. And shoulders is focusing for people who sit a lot. At the moment, we have our workstations not really well designed at the kitchen table,
That's
or you
true.
basically putting so much stress on the shoulders and neck muscle, then it's all coming to one big tension. And my stretch shoulder class is a lot about mobility for that joint, for that part of the body. So opening and stretching the muscles, stretching your neck will really help to feel better and distress your muscles and your mind as well.
It's so true. And I think there's it's just we have the ability to choose and tailor classes for the specific needs, but I can imagine that there would be people that need a strong core as well as mobile shoulders. So one of the brilliant things about your classes is that you almost can map out the whole week of different types of Pilates, and you have that whole 360 approach to strength training. So that's really brilliant. And do you see people matching it? So do you see people doing a few different classes across the week and kind of just doing it all under one umbrella for the strength routine?
Definitely. With quite nice combination is like postnatal classes together with the shoulder mobility classes. If you're carrying your baby, all tensing in your shoulder, breastfeeding, feeding, it's really nice for them to be able to stretch that part of the body. For the runners, hip class and the runners go very well together, or runners and upper body class. It's fantastic combination to kind of unwind and stretch one part, and other part is more to keep it stronger. And definitely I will advise.
Amazing. Well, guys, here we are, sorted it all for you. So the job is done for you. Olga, thank you very much. It's been actually very helpful, and I hope there's a lot of people that got a little bit more information about how to map out the Pilates, because I think it sometimes can be a minefield to try to combine all the things together. Whether you're a new mom and there's a lot of things that are happening in your day, or whether you're a runner and you normally stick to quite a lot of running in your week. I think it's really important to know that there's always a way to fit around your schedule. And the best thing about your classes is that they're done through Zoom, meaning that you don't have to actually add additional hours of commuting, of going changing, all that is taken away, which makes it much easier to fit around everyone's schedule. So, well, guys, thank you very much.
Thank you for having me.
Pleasure, and we're looking forward to having you again.
See you soon then. See you for now.
Have a great evening.
Thank you.